My name is Roshni Kakaya, and I'm a board-certified family medicine physician passionate about sexual and reproductive health. I created the company Kizazi Gyne with the specific goal to address inequity in pain management for common in-office gynecological procedures. I'm really excited to show you and train you on how to do paracervical blocks today using this novel procedural simulation model that I have created. As you all know, paracervical blocks are an effective method of pain control for in-office gynecological procedures and are commonly used for IUD placements and procedural abortions. I believe that if you are a clinician and you are doing IUDs in your office, you should also be offering paracervical blocks, and you should feel confident to offer that to your patients. Today's video, I'm not really going to tell you exactly how to do the paracervical block. I recognize that there's a lot of variety and different institutions have different preferences. I will share with you what I do, but really the goal for today is to use this video to teach you how to use these hands-on models so that you feel more comfortable with your training. This model comes with 2 levels of cervixes. One is a beginner level that's got a little bit more obvious anatomy, really good for beginners who are trying to figure out where exactly do I put the needle, things like that. And then the second level is an advanced level. This is where it's a little bit harder to see that anatomy. You really got to use the tenaculum to move the cervix around so that you can see exactly where you need to inject and insert your needle. Whether this is your first time ever learning about paracervical blocks or you just needed a quick refresher, this video is going to be for you. Let's start by discussing the materials that you are going to need for your training. Number 1, a Chucks pad. This simulation does use water and it can splash about, so I think that is helpful for you. Number 2, a tenaculum. Number 3, your choice of a needle, either a 1 to 1.5 inch 25 gauge needle or a spinal needle. In this simulation, I am using a 1 inch 25 gauge needle. Number 4, a needle extender. You'll see here that I have a needle extender attached to my syringe. I find needle extenders to be helpful for trainees when they're first learning to do paracervical blocks. Of course, if you're doing a spinal needle, you do not need a needle extender. And for this simulation model, you also don't need one, but I am including it here just to be complete. Number 5, a 10 or a 20 cc syringe. And number 6, a cup for water to simulate the lidocaine. My approach is to use 20 cc's of 1% lidocaine without epinephrine as my anesthesia of choice. Let's talk about cervical anatomy. What we have here is the beginner, more anatomically obvious model. You have the cervix here and the cervical os right here in the middle. When you're doing your paracervical blocks, you are going to inject lateral to the actual cervix in these vaginal fornices, lateral vaginal fornices. You can think about it like a clock, starting at 12 o'clock, 6 o'clock, 3 o'clock, 9 o'clock. Let's practice tenaculum placement. Most people, when they're placing their tenaculums, are placing it at the 12 o'clock position. What you're going to do is you're going to inject the bevel of the needle very superficially, just so the bevel is covered, and then you're going to practice injecting 1 to 2 cc's into the model. I don't actually recommend practicing on this model, injecting, because it'll squirt right back out at you. And then what you're going to do is you're going to go ahead and place your tenaculum. Let's practice doing the tenaculum placement on the more advanced model. So again, we're practicing hubbing the bevel of the needle, pretending to inject 1 to 2 cc's to create a wheel. Then we're going to go ahead and place the tenaculum. Now let's practice our 2-point paracervical block. Since you have placed the tenaculum already, you're going to go ahead and inject into the 4 o'clock location just outside of the cervix here. You're going to inject the needle about 1 to 3 centimeters. Once you get there, you're going to aspirate to ensure that you're not in any vessels, and then you're going to go ahead and you're going to inject. Then you're going to come out. You're then going to move to the 8 o'clock position, paracervically. You're going to inject again 1 to 3 centimeters. Once you get to where you want to be, you're going to aspirate again, and then you're going to go ahead and inject the rest of your lidocaine. And then you're going to go ahead and come on out. Let's practice the 2-point paracervical block using the advanced cervix. As you see here, you really do have to use the tenaculum to manipulate the cervix around. So here, we're going to use the tenaculum to move the cervix to the side. We're going to inject at the 8 o'clock position, 1 to 3 centimeters. You're going to retreat, aspirate, and then you're going to inject. If you feel resistance, you can either pull back or you can inject a little bit more. You can hear that it's going, and there will be a visual inspection too that you can do. Next, you're going to use the tenaculum. You're going to move that cervix to the other side to get to the 4 o'clock position. Once you get there, you're going to aspirate, and then you're going to inject. And you know that you're in the right spot because you're able to inject that fluid. And then you're going to come right back out. Now let's practice the 4-point paracervical block. You are going to inject at 2 o'clock, 4 o'clock, 8 o'clock, and 10 o'clock. Very similar concepts. You're going to go ahead and inject, insert the needle 1 to 3 centimeters. You can pull back on the tenaculum if you need resistance. You're going to aspirate, and then you're going to inject 5 cc's for the paracervical block. Then you're going to inject at 4 o'clock again, insert 1 to 3 centimeters, aspirate, then you're going to inject. You're going to inject at 8 o'clock here, about 1 to 3 centimeters, aspirate, and inject. Then you're going to inject at 10 o'clock, 1 to 3 centimeters, aspirate, and then inject the rest of the 5 cc's. So you still do a total of 20 cc's, just spread out a little bit. And that's your 4-point paracervical block. Now let's practice a 4-point paracervical block using the more advanced cervix. Here again, you see you really have to manipulate the cervix using the tenaculum. You're able to inject 1 to 3 centimeters at the 2 o'clock position, aspirate, and inject. You're going to come out again. Use that tenaculum to give you better visualization. Inject 1 to 3 centimeters. You're going to aspirate and inject at the 4 o'clock position. Then you're going to come back. You're going to find the 8 o'clock position, inject 1 to 3 centimeters, aspirate, then you're going to inject, pull that needle out, and then lastly, you're going to inject at the 10 o'clock position, aspirate, and then inject the rest of the lidocaine here. And then you're going to come out. I'm going to offer some tips and tricks to help make your paracervical blocks a little smoother. Tip number 1, some people like to use sodium bicarb to help buffer their lidocaine injection. This helps remove the sting for the patient and can make the whole process a little bit more comfortable. It does take a little work on your end. If you are going to use the sodium bicarb to buffer, I recommend using 1 cc of sodium bicarb, 8.4% for every 10 cc's of lidocaine that you are injecting into the patient. My second tip, we already discussed aspirating, how important that is, and showed in the hands-on part of the video exactly how to do that. Another method that people use is they actually continue continuously move the needle in and out a few millimeters, just to ensure that when they're injecting, they're not injecting into the same place. So that is another approach that some people can take to prevent injecting into the vessels. And then lastly, I do recommend waiting at least 1 to 2 minutes after you have done the injection. You know, this can be when you're talking to the patient, setting up your tray. You really want to allow that medication to take as much effect as possible and keep your patients as comfortable as possible. That's it. I hope this video makes you feel comfortable with training and even more comfortable offering paracervical blocks to your patients. These kits are available to purchase online at kizazigyne.com. The link will be provided here. And please feel free to reach out if you have any questions. And I'm so grateful that you took the time to watch this video today.